welcome back. Well, many of you probably have heard of the Chiropractic Health or have one you go to a couple times a year, but do you really know the effects it has on your body? That's why we have Dr. Jason Raesz here to educate us on exactly what they do. Well, thank you for being here today.
Thank you, Marlena. Thank you for having me.
Yes, of course, and a little later we're going to get John on this thing to talk about his spinal health, but first tell us a little bit about what Chiropractic Health is.
You know, health in general, so if you ask the majority of Americans what they thought health was, they would say it's based on how you feel or how you look. Well, if we looked in the World Health Organization, they would define health as the optimal function of the body. The key word there is the function. And whenever we go to this chart, what controls all function of the body? Well, the thing that controls all function of the body is the brain. And the brain sends signals down the spinal cord like a river running down. And if you have any areas where the spine is out of alignment, then that flow, that life flow from your brain down to the rest of your body, that can be impinged and interfere with the life, right?
Right.
Now, let me ask you a question, Marlena. If someone cut your head off, would you die?
Yes.
Yeah. If someone cut the nerve root to the heart, would you die? Or would the heart die?
Yes.
Yes. So we're not talking, are we talking fact or are we talking theory here? We're talking fact, right? It's like gravity, it's a law of life, right? Now, if we were to back that off just 50% and say, let's not cut off the head, but let's say there's a nerve irritation here, there's a pinching of the nerve, well, guess what? These organs, these cells, these tissues, are they getting healthier or are they getting sicker? They're getting sicker.
Right.
So if you have any kind of interference here, any kind of pinching or pressure on the nerves, then it's going to cause dysfunction in your body. That's going to lead to disease process, and that leads to symptoms. And symptoms like headaches, blood pressure issues, respiratory issues, digestive issues, pain or numbness or tingling of any kind, that's just a symptom in your body. And your body's telling you, please help me, I have a problem, I need help.
Right.
So as a chiropractor, we check the nervous system, we check the spinal alignment. If somebody does have what we call subluxations, that's a misalignment of the spine, that's pressure on the nerves, then that's going to cause this dysfunction, that's going to cause the disease, that's going to cause symptoms down the road. So we want to remove that pressure. We want to get people healthy. And we want to do that without the use of any kind of medications or surgeries or anything like that.
Right.
Yeah.
Well, we got this machine here, and I guess I'm going to be kind of the guinea pig.
Yes.
Check it out.
So,
Yeah.
Dr. Raesz, just kind of tell us what this machine is and exactly what John's
Yeah, I
about to
stand
do.
this way,
So
right?
this is called a spinal analysis machine, and John's just going to step up on it and he's going to look straight ahead here. What I'm going to do is, with this machine today, we're really just going to line up a couple of the lines and we're going to look at his hips and we're going to look at the bottom of his head here.
Okay.
So look straight ahead here, John.
Okay.
So this one I'm just placing right on the bottom of his head, and then I'm going to press into your hips. Do you mind if I press in here? Okay, and so when we look at the hips there, good. Okay, you can step down here, John.
Okay.
So now what I did is I took this bottom line, I put in the middle of the tailbone, I put this one through the top of his head. The spine should go straight up and down. What we see is that his spine actually shifts further to the right, almost an inch to the right. Now when we look at the hips should be level. His hips are torqued down on the left. And then as we come up, his head goes back to the right. So we do see that there is this abnormal alignment there, right? And so in this case with John, if he has an abnormal alignment in the lower back, not only could it cause low back pain, but it eventually could irritate the nerves that go down the legs. That could cause numbness, tingling, weakness into the legs. You know, those same nerves go into the pelvic organs that can cause constipation, diarrhea, urinary problems. It could even cause stomach problems, digestive problems, right?
Wow.
And so those pinching of the nerves there, those subluxations, that's what leads to those disease processes and those symptoms.
Wow. So I would, come to you to potentially have this fixed. Is there a way we could do that, or?
You know, that's a great question. And so whenever a patient does come to the clinic, we, of course, pride ourselves. We feel like we're the best chiropractor in Central Texas, of course, right? And the reason for that is because we do such a thorough job whenever a patient comes in. When you come in, we do a consultation. I sit down with you and I ask you ask you about your symptoms. I also ask you about your health goals, because I want to know what you want to be doing when you're 70, 80, 90 years old. I want to know, do you want to enjoy retirement, play with your grandkids? Do you want to live out all the life, all the dreams in your heart, all those different types of things, right? Then we do an exam. The exam's very thorough. We do orthopedic tests that tells me about your joints. We do neurologic tests that tells me if you do have any pinching or pressure on the nerves here causing this dysfunction in your body. right? Then we do chiropractic tests that tells me if chiropractic care is right for you. Then we take x-rays. We have digital x-rays, so we bring up your x-rays. On the second visit, we have you come back, we bring up the x-rays in a big digital monitor, and I show you exactly what's going on. So this is not a diagnostic test. The x-rays would be though.
Yep.
So when we bring up the x-rays, we'll be able to see if you do have subluxations, if you do have nerve interference, and then we would talk about, you know, getting you out of pain, fixing the problem, and getting you healthier overall.
It's very interesting. Well, we're going to do a little special. So if we, if any of our viewers come into Advanced Chiropractics in Temple, what's the address?
You know, it's 2314 West Adams
Okay.
in Temple. It's right across from the Salmons Golf Course.
Great. So if they walk in, so what kind of special do you have for our viewers?
Well, we have a special for you. For anyone that comes in and says they saw me on the KWTX, they can come in, and if they mention that, then they get the consultation, the entire examination, all the necessary x-rays, and that second visit to go over those results. It's normally $226, but it would just be $59 for the viewers today. Yep. Now, I will have to put an expiration date on that, so as long as they come in the month of August, then we can honor that.
Okay, great.
deal.
Yeah.
Well, thank you so much, Dr. Raesz,
Hey.
for telling us about all this great stuff.
I loved it. Thank you so much.
All right, and we'll be right back.